This video section focuses on vital signs, which are essential for resident monitoring and early detection of health changes. Vital signs measure how well the body's basic functions are working. The 5 vital signs we focus on are temperature, blood pressure, pulse, respirations, and oxygen saturation. Temperature measures body heat, with a normal range between 97.8 and 99.1 degrees Fahrenheit. Report immediately if a fever is accompanied by confusion, chills, cough, pain, or if there's a sudden temperature change. Blood pressure measures the force of blood against artery walls. Normal is around 120/80. High or low BP should be monitored, and staff should watch for dizziness, weakness, headache, or fainting. Pulse, or heart rate, measures heartbeats per minute. The normal adult range is 60 to 100 BPM. Report an irregular rhythm, a sudden change from baseline, or a high or low pulse paired with chest pain or shortness of breath. Respirations measure the breathing rate, with a normal adult range of 12 to 20 breaths per minute. Abnormal signs include fast, slow, labored, or shallow breathing. Emergency signs are gasping, blue lips, or inability to speak full sentences. Oxygen saturation, or O2, measures the oxygen level in the blood. A normal range is 95 to 100%. Report immediately if O2 levels drop suddenly, fall below ordered parameters, or if the resident experiences shortness of breath. Check vital signs during a change of condition, after a fall, or if a resident complains of pain or illness. Staff must measure accurately, compare readings to the resident's baseline, and report and document abnormal results immediately. Call 911 immediately for difficulty breathing, chest pain, an unresponsive resident, dangerously low O2, or severe BP or pulse changes with symptoms. When documenting vital signs, always include the date and time, the readings, resident symptoms, who was notified, instructions received, and the resident's response. Remember, vital signs save lives. Early detection of changes leads to early intervention and better outcomes for the residents. Next, we will cover body checks, an important component of resident safety and early detection. A body check is a visual inspection to identify injuries, bruising, skin breakdown, swelling, redness, or any changes from the resident's baseline condition. The purpose of a body check is to detect injuries early, identify signs of abuse or neglect, prevent pressure injuries, support change of condition reporting, and ensure resident safety. Perform a body check upon admission, after falls or incidents, after returning from a hospital or ER, or when there is unexplained pain or behavioral changes. Also check when directed by a nurse or administrator. Before starting a body check, explain the procedure to the resident. Ensure their privacy and dignity. Use gloves if necessary. Provide adequate lighting, and be respectful of cultural preferences. During the check, look for bruises, cuts, scrapes, open areas, redness, swelling, pressure areas, rashes, or any signs of pain or discomfort. Be aware of the typical stages of bruise color changes. New bruises are red or pink, then turn blue or purple as they heal, progressing to green, yellow, and finally brown or skin tone. In older adults, bruising is more common and takes longer to heal. Understanding the color stages helps staff observe accurately, document objectively, and report appropriately. Immediately report any abnormal findings like unexplained injuries, rapid swelling, severe pain, open wounds, bleeding, signs of infection, or sudden changes from the resident's baseline. Be alert for signs of abuse or neglect, such as unexplained marks, fearful behavior, poor hygiene, or untreated wounds. Follow mandated reporting procedures immediately. After the body check, ensure the resident is comfortable, report findings promptly, Follow any instructions from the nurse or administrator and continue monitoring the resident. Documentation must include the date and time, the reason for the check, specific findings using objective language, resident statements, notifications made, and any actions taken. Escalate the situation when you find open wounds, severe or worsening pain, sudden swelling, signs of abuse or neglect, or any concerning change in condition. Key reminders for body checks: respect dignity, never ignore findings, report when in doubt, and remember that documentation protects both residents and staff. We will now discuss the fatal six, which are the most common preventable causes of death in care facilities. The fatal six include aspiration, choking, seizures, dehydration, constipation or bowel obstruction, and undetected infections. Prevention and early action are critical. To prevent aspiration and choking, strictly follow diet orders, supervise high-risk residents, never rush feeding, and know all emergency response steps. For seizures, know each resident's protocol. Never restrain them during a seizure, time the seizure duration, and call 911 when required by protocol. Prevent dehydration by encouraging fluids as ordered and monitoring intake and output. Watch for dry mouth, dark urine, and fatigue as warning signs. To prevent complications from constipation, monitor bowel movements closely. Report immediately if there is no bowel movement per the resident's care plan. Also watch for abdominal pain, vomiting, or bloating. For undetected infections, look for fever or behavior changes, coughing, foul-smelling urine, decreased appetite, or confusion. Report any early signs immediately to prevent severe complications.